Hi, my name is Dr. Saad. I am a child and adolescent psychiatry fellow in the US. Today I'm going to talk about Surgeon General's advisory, which is a public statement that calls the American people's attention to an urgent public health issue. Mental health conditions can be influenced by biological and environmental factors. Biological factors like genes, brain chemistry, and environmental factors can range from birth complications, exposure to drug or alcohol during pregnancy, adverse childhood events like abuse, neglect, or community violence. The advisory offers some alarming statistics. For example, from 2009 to 2019, the proportion of high school students reporting feeling of sadness or hopelessness increased by 40%. Considering suicide increased by 36%, and the students having a plan of attempting suicide increased by 44%. Been seeing the alarming rise of mental health conditions in younger population for quite some time. For example, between 2007 and 2018, suicide rate among youth aged 10 to 24 in the US increased by 57%. So even before the COVID, the trend was on the rise. However, with the COVID-19 pandemic, the trend just went further up. The prevalence of mental health condition varies among different population and subgroups. For example, girls are more likely to be diagnosed with anxiety, depression, or eating disorder, whereas boys are more likely to be diagnosed with behavioral disorder like ADHD, or death by suicide are more common in boys. Now, the reason for sharing these statistics is not to create a fear or panic, but to create an awareness so that we educate ourselves and support people who are around us that need mental health care or support. Now, there are significant risk factors to youth mental health symptoms during the pandemic. So the advisory shares that someone who already have a mental health condition before pandemic, like someone who already suffered from depression, anxiety, or intellectual disability, will have more symptoms during the pandemic. Number being a family member of any frontline worker living in an urban area or area with worse COVID-19 outbreaks, family member died of COVID-19 infection, adverse childhood events like trauma, abuse, neglect, discrimination, or community violence, disruption in routine life such as not seeing friends, colleagues, going to school in person. So all of these are some of the risk factors contributing to youth mental health symptoms. Now, if you are a parent or a caregiver or concerned family member who wants to provide support, so what can we do? Yes, we can do certain things. First, we need to understand that a lot of mental health conditions are preventable and as well as treatable. So what we can do? Again, first, as a parent or caregiver, we need to provide a supportive, caring, comfortable, stable household environment to our kids. Have them, give them that encouragement, give them the support that they need so that they feel comfortable sharing what they have been experiencing. They should have no fear of being judged or being punished, that they can openly share their expression, feelings with us. Try to minimize negative influences in behavior in young people. For example, talk to the children about the risk and complications or disadvantages of using alcohol or drugs. I have seen significant rise in use of marijuana in young population. They've been vaping. It depends on what area you live. There are different kind of drugs out there which these young populations are using just to feel cool or under peer pressure, or sometimes to relieve the anxiety or depression, and they find drugs to be more helpful than talking to or expressing their feelings to a caring family member. And that's very unfortunate. So we should talk about the risk of drugs, like some short-term complication of car accident or crashes, and some long-term complication like that, how it affects the brain development and how it can cause different mental health conditions. And this can be done, first we need to educate ourselves, and then to provide that education to our kids. We should say the things in simple words so that they can understand by giving them some examples maybe. Also, try to check the behavior and activities of your kids. For example, a kid who is being very social, like to go out, talk to the family members, spend time in the family gathering. Now he's being more isolated, locked himself in their room, spending too much time in playing video games or watching videos. So, or have disrupt sleep pattern, appetite changes. These are some alarming signs and symptoms that we need to look for our children, and if important, needs to be addressed in a very calm way that they feel comfortable. Because a lot of these the older kids or adolescent teenagers are very concerned about their privacy, or they don't want to share their feelings or what they're going through in the school. Some of them being judged based on their appearances or being bullied in school, and they don't want to tell to their parents because that makes them feel weaker, but it also suffers them with different mental health conditions that can be reflected on their academic performances. So we just need to look for them, and maybe just address them. If you think that a mental health professional would be a better option, don't feel shy to take them to a psychologist or a psychiatrist. What a youth can do, like if you're youth or children and even an adult listening to this video, what we can do for our treatment first and foremost is to understand that mental health conditions are preventable and treatable. Not all of them, but most of the common ones. We have very good medications, and in a lot of cases I don't even prescribe medication to my kids and just refer them to a therapy. And there are a lot of very good nice therapy like CBT, which is called cognitive behavioral therapy, been out there for years. Trauma focused CBT for PTSD, other trauma in life, psychodynamic psychotherapy, and there are a lot of other therapies out there where you can talk with a therapist and work on these conflicting issues or mental health challenges that you are facing. So don't feel shy to ask for help, seek help, go talk to a mental health professional. Invest in healthy relationships. Social connection is very important. Now I know with the social media we have so many friends that we don't even know we're here. But let's reach out to the people who we know, who we truly care about, or we know in the past. Give them a call, give them a text message, connect with them, because it has been seen that social connection is a very, very powerful buffer and a source of well-being. What else we can do? Creating a very healthy routine and sticking to it, or try to stick to it. Eating healthy, have a quality sleep. Sleep is very, very important. And I've seen the patients coming with a different sleep problem, and the common thing is that they have a very poor sleep hygiene, watching TV, right? Going to bed at different times. So creating a proper sleep routine is also very important. And then if those things, if after proper sleep hygiene, if still you have a sleep problem, then yeah, go to a doctor. There are some medications or meditations and medications that can be used to give you a proper sleep, because proper sleep has a very significant role in our mental well-being. Also, exercise a few times a week is very beneficial. Research has also shown the benefits of exercising, especially in the morning. Learn and practice some strategies to help you cope with the stress. So try to identify the common factors or the things that you know also they are very stressful for you. Then try to identify them and then learn some strategies how to cope with them I'm not talking about the drugs, but some healthy strategies and skills that you can learn. Be aware of how much time we spend on our social media, on these electronic devices, and try to manage them. I'm not saying don't use social media at all. I'm just saying like keeping a track of it. Like, are you spending an hour, 2 hours, 10 hours? More or less, just to be more aware and maybe cut it down and try to invest that time into some healthy activities, right? Building social connection, or reading a nice book, or going and doing exercise, So time is limited, so we need to learn how to invest our time in some activities which are more productive. And even if you are a youth, young adult, children, provide support to your friends. If you're a parent, try to support to your kids, people around you, spread love. Thank you very much for listening to me. I really appreciate your time. I hope you have learned something from it. I would advise to read the Surgeon General's advisory, which is public and available online for further details. And this is my first video. I'm open for your suggestions and feedback. Please feel free to like, share, comment on this video. Thank you very much.